Hi, let's talk about the pulmonary plexuses. In this video, I'll describe the basic structure of autonomic innervation of thoracic viscera with a special emphasis on the pulmonary plexuses. This should be a nice review of what we've discussed in the previous sessions regarding thoracic autonomics. Now recall there are three major types of autonomic plexus in the thorax. There are the cardiac plexuses, pulmonary plexuses, which we'll be focusing on in this video, and the esophageal plexus. And there will be extensive communication between all of these plexuses. You're not going to see the actual plexuses in the laboratory, but it's important that you understand where they're located so that you can appreciate their anatomical relationships, especially with regards to their function. Now, in terms of inputs into an autonomic plexus, there are going to be sympathetic and parasympathetic. And in the case of the thorax, the sympathetic inputs are going to come from the sympathetic trunks. And there will be both cervical sympathetic trunk inputs as well as thoracic sympathetic trunk inputs, and we'll discuss the particular branches from individual ganglia. Keeping in mind that in terms of the visceral afferents that accompany the sympathetics are the visceral pain fibers. The visceral afferents that are associated with the parasympathetics, which we'll get to, are associated with various autonomic feedback and reflexes. But let's step back to the sympathetics for a second. Recall that within an autonomic division, whether it's sympathetic or parasympathetic, there will be preganglionic and postganglionic fibers. The preganglionics for both the cervical and thoracic branches that are going to supply the thoracic viscera are going to come overwhelmingly from white rami communicantes from T1 through T5, and sometimes T6. So those are what are the sympathetic outflow to the sympathetic trunk. And then those fibers can descend, ascend, they can go back via gray rami communicantes to the ventral primary rami of spinal nerves, etc. The parasympathetic supply to thoracic viscera will come from the vagus nerves, cranial nerve 10, and branches of the vagus nerves, as we'll see. So let's start with the sympathetic branches. The sympathetic branches supplying thoracic viscera are going to come from the cervical sympathetic trunk, which consists of superior, middle, and inferior ganglia. So these will all send cardiac branches. I know we're talking about the pulmonary plexus, but these are cardiac branches. And then there will be cardiac branches from the second, third, fourth, fifth, and sixth thoracic ganglia that are heading to the pulmonary plexuses, as well as likely branches from T1 via the cardiac plexus, which is a minor portion of the sympathetic supply, but probably there as well. But we typically think of the sympathetic flow to the pulmonary plexuses as being T2 through T5, and sometimes T6. The vagus nerves, and we've seen this before, there will be superior cardiac branches coming down with the vagus nerves in the carotid sheaths, descending the neck. There will also be inferior cardiac branches at the base of the neck, towards the root of the neck. There are recurrent laryngeal nerves on the right side. The right recurrent laryngeal nerve wraps around the right subclavian artery. On the left side, it wraps around the concavity of the aorta, and then these both head up to the larynx, as we recall. But they will supply branches to the cardiac and pulmonary and esophageal plexuses. And then the vagus nerves, once they pass the roots of the lungs, and they'll pass posterior to the roots of the lungs, they're going to move from a left-right orientation to an anterior-posterior orientation, with the anterior vagal trunk being mostly from fibers of the left vagus, somewhat of the right, and the posterior vagal trunk being mostly fibers from the right vagus, but also some from the left. And we remember this with the mnemonic, as you might recall, LARP. Left goes to the anterior trunk, right goes to the posterior trunk. Now let's take a look at these plexuses, but let's also keep in mind that these plexuses are going to be contiguous with the cardiac plexuses. So the pulmonary plexuses are distributed on the anterior and the posterior surfaces of the roots of the lung. So the anterior plexuses, both left and right, are going to be relatively tiny, and their input is predominantly going to come from this superficial cardiac plexus. So we're talking about cardiac branch from the superior cervical ganglion of the sympathetic trunk and superior cardiac branches of the vagus nerves. The posterior pulmonary plexuses are posterior to the roots of the lung, so they're going to be back there. And these are going to be the bulk of the bronchial innervation, probably about 80% plus of it. These are in very close association with the deep cardiac plexus and will have all of the same inputs from it. So we're talking about cardiac branches of all of the cervical ganglia, superior, middle, and inferior. Cardiac branches of thoracic ganglia T1 through T5, but for the pulmonary plexus, most of these fibers are T2 through T5 and sometimes a little bit of T6, as well as cardiac branches of the vagus nerves and branches from the recurrent laryngeal nerves. So pulmonary plexuses, minor are anterior left and right, major are posterior left and right, and they have many of the same inputs as the cardiac plexuses that we've already discussed. In terms of pulmonary responses to autonomic stimuli, specifically the bronchi and the pulmonary vasculature, in a sympathetic response, we'll have bronchodilation, so we'll have relaxation of smooth muscle. You can remember this because a shot of epinephrine, an epi shot into the lateral thigh, is going to lead to bronchodilation. And a sympathetic response will also lead to vasoconstriction of the pulmonary arteries, because sympathetics with all vasculature, with the exception of the coronary arteries, are going to lead to vasoconstriction. In terms of a parasympathetic response, we'll have bronchoconstriction, and this is just the maintenance of smooth muscle tone of the tracheobronchial tree, and we'll have vasodilation of the pulmonary arteries. In addition to this, there will also be respiratory responses, but these aren't modulated by the pulmonary plexuses. So any increase or decrease in rate of respiration comes from the brainstem directly, and not the pulmonary plexuses. So we've discussed the autonomic innervation of thoracic viscera, the cervical and thoracic sympathetic trunks, and where they get their input from. We've also discussed the pathways and branches of the vagus nerves and the anterior and posterior pulmonary plexuses, both left and right, and how they're in very strong communication with the superficial and deep cardiac plexuses, respectively. This is your summary slide. Thank you for your time.